So one of the observations about current clinical practice in terms of information technology is that lots of the information that is available is in different silos. The systems in one organisation don't talk to another currently, and that makes providing care difficult and potentially is dangerous when we don't know what another organisation knows, or we don't have their information. And hopefully as we move forward, those barriers will start to come down, and HIE is an example of how that can happen, that we now have broken down the barrier between ourselves and primary care, and we can see each other's information, and that's a huge improvement in the clinical safety and providing safe clinical care.
On the Wirral, the Health Wirral partners come up with a vision for people to live longer, healthier lives no matter where they are born or live on the Wirral. And so by delivering the systems that we are delivering, it's enabling us to move from a system of reactive care to proactive care. It enables clinicians and analysts to identify areas of risk and intervene before patients move into that high risk factor.
Well, we've put Health Information Exchange alongside the Healthy Intent implementation, which we call the Wirral Care Record, which takes a copy of the data from the different source systems and allows us to bring it together to analyse the population and to create registries which allow us to focus on people with chronic conditions. So at the population level, we can target people with COPD or asthma or diabetes, and then individual clinicians can deal with individual patients having access to the whole record via HIE.
We work closely with the child mental health teams. We're really wanting to build up links with those teams. We've got quite good links with the mental health teams, but we'd love to involve them in sharing information as well, and potentially eventually the local authority as well.
So what we know is, because we're using HIE better now and we don't have to make those phone calls to the GPs, we're looking at the wider view now. We're looking into the community, social care and mental health, and that's a really positive move. Once they are all on board, we'll be able to see the entire record, which again will improve the health of our population.
I think it can only be a good thing that other local organisations join this to have that information first hand, not relying on another agency or another service to get back to them, and they can move things along quite quickly for families.
So the longitudinal care plan is much better for the population, and what that means is we all are cited on our patient's record, looking at health prevention before an acute admission, and ultimately we all want a healthier population.